Hi, my name is Adebayo Christopher Adedoyin. I'm an anesthetic technician and I do make supply of medical consumables to all Nigeria hospitals. So please remember, if you know you have not subscribed to my YouTube channel, please do subscribe because I do release my video on a daily basis so that when all these videos are being released, you can equally access them at will. And secondly, if you need my help concerning medical consumables or medical devices, so please don't hesitate in contacting me. I'm readily available to attend to all your requests. So today we're going to be discussing one of the oxygen delivering devices, which we call the FITA mask or the medium concentration oxygen mask. Mind you, during one of my videos, I told you that we have a whole lot of all these devices being used within the hospital environment and outside hospital environment. And what are they? We have the Silente mask kit, we have the high concentration oxygen mask, which we also call the rebreather mask. We have a multi-use ventilator mask kit, we have the oxygen recovering TPs, we have the oxygen recovering TPs with reservoir bag, we have the nasal cannula. In fact, we have a whole lot of all these devices being used. But among all these medical systems, we are going to be discussing just one of them, which is the FITA mask. Mind you, the FITA mask is unique from every other. And what makes it to be unique? These are part of what we are going to be discussing as we go on with this particular video. So FITA mask is one of the oxygen delivering devices that help to deliver medical gases to patients while filtering out the bacteria and viruses found in the inhale and exhale air. What do I mean by this? It means this device helps to protect both the medical staff and also protect the patient from cross-contamination. So this is the device. This is how it comes. So this is the mask, and on the side of the expiratory port, it has a filter bed on both sides of the nose. Filter bed. This is it, and also came with the connector with 2.1 meter connector, because it is through this connector that we get the source of oxygen or the source of medical gases. This is it. So this is how it comes, and this is trap. So this device, I told you before, that is unique in its own way. Why? Because it helps to protect both the medical staff and the patient from cross-contamination. Okay, why do I say this? Like if you check the respiratory port, it has this filter bed that help to prevent the bacteria or viruses from going out of the patient or from coming into the patient. And so unlike every other system that just deliver medical gas to patient, this one don't just deliver, but it also help to filter out. So, and then secondly, this particular device is also being used in an emergency situations, and it also help to protect the first respondent. But while using this particular device, it is advisable that the flow rate is set at 5 liters per minute or 40% of oxygen. Why? Because it helps to prevent the patient from rebreathing his own CO2. But if the flow rate is set below, 5 liters per minute, there is a possibility of the patient rebreathing its own CO2, and this may be dangerous because sometimes you see patients coming up with headache, with a dizziness after the procedure. Most time it is as a result of the patient rebreathing his own CO2. So in order to prevent all of these things, so while using this medical device, it is advisable that the flow rate is set at 5 liters per minute. Thank you very much for watching my video. All right, I've come to the end of the video. See you in my next video.